This time I'd ask all of our panelists to put their video live so our audience can see everyone. Thank you. Good afternoon and welcome to this afternoon's Faculty and Staff Town Hall with President Fred Postello and a panel of university leaders who have been working actively all summer in preparation for the August 17th start of the fall semester. This town hall will be a continuation of the town hall that was held on August the 5th. I'm Jeff Fowler, Vice President of Marketing and Communications. On the panel with Dr. Postello today are Interim Provost, Dr. Michael Lewis, Vice President of University Compliance and Ethics, Jessica Evenson, Vice President for Facilities Management, Michael Lucido, Interim Vice President for Student Development, Dr. Debie Lohe, Vice President for Human Resources, Mickey Luna, Associate Dean and Professor of Epidemiology and Biostatistics, Dr. Terri Rebmann, Vice President for Diversity and Community Engagement, Dr. Jonathan Smith, Staff Advisory Committee Chair, Sue Stevens, and Faculty Senate President and President-elect, Drs. Ruth Evans and Terri Rebmann. Before we begin, just a couple of reminders. This town hall will run approximately 1 hour till 5:30. The town hall is being recorded and will be posted online for those who did not get a chance to attend today or who would like to review it again. Our panel will be answering some of the questions that have already been submitted through the online form. And please note that we have turned off the chat function for this live stream for security purposes. If you have not yet submitted a question and would like to do so, if you look at the bottom of your screen, you will see there's a Q&A queue there. You can click on that and you can type in your question. We have staff who are monitoring the Q&A and they will be passing along your questions as time permits. So thank you all for being with us here today. At this time, I'll turn it over to Dr. Postello for his opening remarks, and he'll be followed by Interim Provost Dr. Lewis.
Yep, forgot to unmute. Thank you, Mr. Fowler. Thank all of you for joining us for the second virtual town hall focused on the return of our students and the start of the term. It's already been an exciting day. Some of you have participated in new faculty orientation, which was held today from early this morning at the start of the day, and we just concluded a reception. So many of us have had a chance to meet with our new faculty across the entire institution. I've had a chance to meet virtually also with many of our returning students. I met with our ORFOM leaders and our residence hall advisors, so you can feel the energy coming back to campus as we welcome those who are returning and those who are new to the institution. So once again, I want to thank all of you who worked so hard over the summer to redesign courses, to adjust pedagogy, to modify processes, redesign spaces, create and edit critical communications, and all the other hard work that was necessary to prepare for this week and beyond. The volume of work and the hours invested has been enormous. I'm not going to repeat my comments from last week's town hall about how challenging and uncertain these times are, or how mission and values and priorities have guided our decision-making thus far and will continue to do so. You know that colleges are approaching this fall in one of a few different ways in terms of having students on campus or not, and the type and mix of instruction that they're offering. And you're aware of the path we've charted. This week, it all begins with student move-in. I believe that one phrase best captures this moment. We are all in this together. The coming days and weeks are going to test our character and our strength as we balance the vigilance of thwarting COVID infections while welcoming our students back to campus with generosity and finalizing the details for the start of the term. As I noted, hundreds of people have put in thousands of hours to identify and plan how the fall semester will occur. and for it to truly be a positive learning experience despite the many COVID prevention practices in place. Our bundle of safeguards must be used by all of us who live and work on campus. We are all in this together. Things are bound to be inconvenient. We are bound to have Wi-Fi glitches and empty copiers. There will be longer lines in the dining halls. Elevator rides will be less convenient. And we know that some students, staff, and faculty will continue to get COVID. But by keeping the most vulnerable away from campus, the risk of severe infection is lessened. Testing students who are not exhibiting COVID symptoms will inform our decision-making. This morning, hundreds of Oriflamme leaders and RAs and other returning students who came in early experienced the testing operation. An operation we only began to devise 4 days ago, when it was clear we could finally find and count on a laboratory to help us. This was a long and difficult process. We will be testing our residential and some off-campus students through next Wednesday. It's 10 days of initial testing. After which we will do random testing of our students. And those protocols are now under development. We are all in this together. Many of you are going to be teaching in unfamiliar and larger classrooms. Students will be much more spread out than is typical. Engaging your students who are there with you in person and those who are online is not going to be easy, especially for those classes in which discussion is a key. But I know your commitment as academicians. You are creative teachers. You are inspiring instructors. You care deeply about our students. I know you are dedicated to their academic success. One by one over the past week, many colleges that committed to face-to-face instruction folded their tents and moved fully online. We are now one of the roughly 40% of American colleges and universities teaching in person or hybrid. A number of our peer institutions will be watching us, I assure you. I've been told that. They may not have been able to take the same road that we have, but several are rooting for our success. They want to get back to campus too, and they want to learn from our experience, and they want to see that it is possible. They see us putting clear public health protocols in place and counting on our students, staff, and faculty to live up to our obligations to one another. As is always the case when a new term begins, but particularly in these uncharted waters, mistakes will be made, balls will be dropped, the unanticipated will present itself, frustration, stress, anxiety will rise. We must all try to be patient, remain calm, step up, pitch in, and solve the problems before us, large and small. Simply kicking everything up the chain will overwhelm the system. And if we overwhelm the system, it will compromise responsiveness on the issues of greatest significance. Now more than ever, it is time to live our values and be one SLU. We are all in this together. Thank you.
Mike Lewis.
Thanks, Jeff. Let me just start out with a reminder of so maybe some helpful links for faculty as I know you're preparing to come back and teach next week. We have, I think, the last of our two syllabus policies, temporary syllabi policies that we've been working on will be added to the Provost website today. And so please look into that. Well, if the message that's coming out from my office that hasn't gone out already, it will go out soon. So please look for that. We continue to work with the President's Office on a travel policy. I think those are the last kind of syllabus statement policy policies that we're working on. Those will be shared soon. You know, I like Fred, I didn't want to repeat the opening remarks I gave last time. So thinking of what I'd share, I think I want to take the remainder of my remarks and address an issue that I've heard a lot from faculty, and I think there's some confusion around it. So I've spoken with faculty and staff in recent weeks, and a common question is what considerations go into the decision for a pivot away from the plans that we currently have in place. I know President Costello will discuss this issue later as far as it comes to what goes into that decision for him. It's ultimately his decision, and a lot will go into that. And like I said, I know he plans on talking about that. The part that I would like to discuss is what it would look like. So should President Costello have to make the decision for us to pivot, what would the pivot look like? What does it look like to go in that direction? That's where I think we have perhaps some confusion. As I speak with faculty, I think I hear a belief that we will just do exactly what we did in the spring and move 100% everything online. And I consider that an unlikely outcome. I think a pivot instead will more likely look like a de-densification strategy. And so that's what I hope people can start thinking. So I don't think we will completely shut down campus as we did in the spring and move fully and completely online. There are many things that could go into a de-densification strategy, I believe. We could choose, and everything I'm going to say now, nothing's been decided. These are examples. We could decide to move the lecture style courses online, but keep all of the experiential courses, so labs, clinicals, studio arts, other experiential courses. They could perhaps stay face-to-face. That would allow us to de-densify the campus. We could consider de-densification strategies around student housing. We could, there are many others ways I think we could think about this, but I do not. I think that it's easy to obviously ground yourself in a lived experience, and we all have one lived experience for how to deal with a pandemic, and that was what we did in March. And I just want to make sure people recognize that that it could look and will likely look different in the fall. With that, I'll wrap up. I just repeat what I've been trying to say all summer. I'm grateful to what everybody has done to prepare for this fall semester. I think we're going to do this in the safest possible manner and provide the face-to-face education experience that our students desire. So thank you.
Thank you, Mike. Before we move on to some of the other questions, we know that many of you in the audience, in addition to being a faculty or a staff member, are also a parent and maybe moving your student or students into residence halls or apartments in the next week. So I'd like to ask Dr. Debie Lohe to give us an overview of move-in and testing that's going to take place starting tomorrow.
Thanks, Jeff. And actually testing, I think, as Fred mentioned, started today for our OFLAM and student staff. So that's good news because it helps us to work out the kinks so that we're ready for the first big day tomorrow. So this year, move-in, I think, as has been shared in a variety of ways, but it's important to recap top health precautions and safeguards we already had in place for move-in. What would typically take place over the course of a single day, all new students moving in on one day, is spread out over 3 days. So that's one of the lessons we learned last spring when we shut down most of our residential buildings, that spreading out the move out or move in process allows us to stagger folks in shifts. It's already the case that in a normal time, you give folks a window of time in which to be on campus to spread it out, but now we're further spreading it out, right? So that we can reduce the number of people on campus at any given time and try to reduce the amount of time folks are in close proximity to people from all over not close proximity, I don't want to overstate that, to folks from everywhere. We also have a requirement that no family members, helpers, or students can go into residential buildings without masks. we have asked everyone with symptoms to stay home or to contact student health right away. They're not allowed to be on campus if they're experiencing symptoms of COVID-19. And limiting the number of family members who can come to help a student move in. So there are a number of precautions and safeguards that we've added. Testing is the newest, as Fred said 4 days ago. No small feat. And I want to just say a word about how we got there, and also a word about how it's what I just experienced over in the testing center while we had a lot of students in line waiting. So I want you to hear that voice as well. So I think it's important to say that our decision to test on-campus residential students really is out of an abundance of caution. I think public health experts were telling us all along that our initial plan not to test as a default position was a sound approach. And I think it's important to keep in mind that that would still be true. I think Dr. Rebmann would support that it is not a scientific necessity to test our on-campus students. But what we're trying to do is mitigate, take science and also think very carefully about people's confidence levels, their psychological safety, the level of anxiety that they're feeling about students moving into residence hall rooms where they're going to live in close proximity and probably have their masks off a lot, which they're allowed to do if both parties agree. So that close quarters maskless living on campus in a room or an apartment is the most important place where helping us to keep students who might test positive out of the residence halls is a useful approach. And I say that because I think it's important for us to just remember that there will be family members who are coming into residential buildings and leaving residential buildings. We're not testing every parent or every brother or every helper because we know that the risks of exposure for those individuals is from the science perspective low. They're going to be masked. They're not going to be in close quarters without masks on, and they're not going to be up next to each other, other people in any real way, right? They're going to move through hallways, but I think Dr. Rebmann has helped us to understand that the science of that says that's not where our risk is going to really come in. And so I want people to know that, because we've gotten some questions about how can you test students but not test parents. That's how. The students are the ones who are going to continue to live here next to each other in a room together without masks on. So that's the logic of that. I think it's important to know. We do continue to think about what an off-campus student testing strategy might look like, and those are things that we're continuing to work on. So the thing I want you to know is that our student leaders who were in line today for testing, and as I said, there were some bumps. That's what you get on the soft launch of an experience like this. Even the students who'd been waiting the longest, they were in great spirits. They were super energetic. I was sort of saying, sorry, it's taking so long. They were like, no, this is what it takes. This is what it is. We want to be the guinea pigs. We want to work this out. We want our student residents tested. So I talked to about 25 students in, sort of pairs from a very far distance in the basketball, in the gym. And really to a person, they were saying, we are grateful that you're doing this. It gives us some confidence. It gives our moms and dads some confidence. Thank you for thinking about it this way. And they overwhelmingly said they felt cared for by the university this summer, and their siblings at other places, or their parents who work at other universities. They just felt like our approach had been really grounded in caring for students, caring for our community, and trying to be transparent about what we're doing and why. So they were super energetic, super excited, and I was really happy to have their energy back on campus.
Thank you, Debbie. We'll begin with some of our questions now that have come in. Most of these have come in since the time that we had our first town hall on August 5th. One of the most common questions we've received, particularly since Friday's announcement that we were going to test residential students as they arrive, is whether we will expand testing protocols to include faculty and staff who work on campus. Dr. Costello, I know that in your message, you said that more information on this would be forthcoming on the protocols. Do you have anything you want to add to that at this point? And then we can move on to maybe Dr. Rebmann.
Yeah, I'll just say a word about that and then turn it over to Dr. Rebmann. At this point, as you know, we plan to test all incoming residential students, and in fact started that today, and we'll do that through the week and beyond. We are going to test some of our non-residential students, we are not going to test faculty and staff who are non-symptomatic and who have not been exposed to the virus, who they do not believe they've been exposed to it. Faculty and staff who believe they've been exposed to the virus or are showing symptoms should contact employee health and do what is recommended by employee health. Terri, I'll turn it over to you to elaborate on that.
Sure. So that was a great explanation of what will happen with faculty and staff moving forward unless our testing plans change. And I mentioned this during the last town hall. All of our testing plans should be considered fluid because they are based on access to local testing, what we find as we start to do testing, and what's happening on campus and regionally. So we are still developing our testing protocols moving forward. So we already have in place the plan to test all of our on-campus students. So they will all be tested as sort of a baseline. And then moving forward, we also hope to do some additional testing on a regular basis. But the exact protocols in terms of how many people and how often that testing is going to happen are still being developed.
Terri, if I can follow up with you, kind of a follow-up question. How will positive test results be communicated, and how will we ensure that an individual's personal information isn't compromised in that process?
Yeah, this is a common question and also a common concern that I've been hearing. So when an individual tests positive, the information is obviously shared with that individual. An individual's infection status is considered to be protected health information, and it's covered under HIPAA law. So therefore, we are not allowed to share that information with other individuals. However, through the contact tracing procedure, once we have an infected individual, we do contact tracing with that person. We identified who has had close contact with that person, and then we contact those individuals and tell them that you have been exposed to somebody that has tested positive for COVID-19. In doing that, we do not tell them the name of the infected individual. Legally, we are not allowed to do that because, again, that would violate the HIPAA laws. In addition, we have to keep in mind that this is very private, sensitive information for individuals, and we need individuals to trust us, including our employees and also our students, because people are only going to cooperate with our contact tracing if they trust that we are holding their private health information protected.
Could I add one note to that, Jeff? I think about the student side of that, just particularly with faculty on the call. Our student health folks will be getting a verbal consent from students about who they may tell, who the student health team may tell or not. And that really is going to be a tiny little group of people. It may include the Dean of Students office if the student is comfortable. What I think is important for faculty to know is that if they hear from a student that they need to be out of class for a period of time, I don't think faculty should assume that the student has tested positive. There could be lots of reasons, including a student may have been exposed to somebody and just is in quarantine, they're able to continue working. So what we're going to be doing is encouraging students to reach out to faculty and say, you know, I'm under the weather, I might not be able to participate very much online, or I'm not going to be in class for a little while. You will probably make an assumption that they're in isolation or quarantine. I also think it's important to know it's still going to be cold and flu season. So just because a student might not be in class because they don't feel well, might not mean they were COVID positive. And so I think we have to be really careful about drawing inferences about that. I know even our international students who might just need to quarantine because that's an expectation coming into the country. Let's not make too many assumptions about that.
Terri Rebmann, one more follow-up question about, you talked about contact tracing and identifying close contacts. Could you further define what is considered to be a close contact?
Sure. So there are two categories of individuals that will fall under the definition of being a close contact. The first is if you are within 6 feet of an infected individual for 15 minutes or longer while the two of you are not wearing masks. And then the second category is having, it could be a shorter period of time, but you have close direct contact with the respiratory secretions of somebody who's infected. So, and that's regardless of whether or not you're wearing a mask. So if, for instance, an individual sneezed directly on you, you wouldn't have to have 15 minutes of being close to that individual for that to count as a close contact. So it can be a very short, brief encounter, depending on what's happening with that encounter. So just a couple of brief summary items about what would constitute a close contact in terms of campus versus what wouldn't. So things that would count as being a close contact would be if you live with somebody who's infected. So roommates, for instance, are going to automatically be considered close contacts. If you share a meal with somebody when you're sitting closer than 6 feet apart because you're not going to have masks on while you're eating. If you're more than 6 feet apart, that would not be considered close contact, but sharing a meal without masks closer than 6 feet is definitely considered close contact. Or again, like I said before, being sneezed or coughed on when you're not wearing a mask, that would be considered close contact. Or it could be something as simple as touching a contaminated object that has that person's respiratory secretions on it. So if you were to pick up somebody's dirty Kleenex, for instance, then if you touched your eyes, your nose, or your mouth, that would be having direct close contact. That would count as an exposure. But there are other activities that we're going to have on a regular basis on campus that are not going to be considered close contact. So that would include things like being in the same classroom with an infected individual, whether that's a student or a faculty member. If everybody's wearing a mask and everybody is staying 6 feet apart, that's not considered close contact. If students live on the same floor or the same building as an infected student, unless they're roommates, that is also not considered to be close contact. If you work in the same building or even the same office as someone else, if your desks or work areas are more than 6 feet apart and everybody's wearing a mask, then that is not considered to be close contact. If you pass an individual in the hallway and everybody's wearing a mask, not considered close contact. And then just one final example, if you are riding on the elevator with an infected individual, but everybody's wearing a mask, that would not be considered close contact.
Thank you, Terri, very much. We're going to take a question now that's been submitted live during our town hall. And the question is, do faculty need to wear a mask while teaching in the classroom if 6 feet of distance can be maintained? My concern is the ability of good recording clear audio for students who are attending the course via Zoom. If so, have plexiglass barriers been considered? Can I wear a face shield to lecture instead? And I'll open that up to anyone.
So we have had discussions about all of those scenarios and options. And our mask policy says that all individuals will be wearing masks in the classroom. And that is based on the current science about what we know about how this disease is transmitted. We don't have great data yet on, actually we have zero evidence related to the protectiveness of plexiglass barriers. So right now, those would all be considered sort of an extra layer of protection, but we could not count those as being the only level of protection between an instructor and students in that classroom. And same thing with the use of face shields versus a mask. You are welcome to wear a face shield on top of your mask if you would like to do that, if you would like an extra level of protection. But based on the current science today, we cannot allow individuals to wear a face shield instead of a mask, because there's very strong evidence that that is not as protective in terms of source control.
Let's move on to the daily symptom checking process. I'm going to ask Jessica Evenson to take us through the new app we've got and what we're asking faculty and staff along with students to do.
Thank you, Jeff. So we, okay, so where do I start? So we have landed on an app called Campus Clear. This is an app that was developed out of Creighton University, and I think over 900 different institutions are using it this fall. It is free to SLU. It's very nimble on the backside. As an administrator, I have, meaning I have the access, myself and 2 other folks have the ability to make some changes in there as things may change. We will roll this out to our student population today, if not tomorrow, inviting them to download the app onto their iPhone or their Android. There is a web-based intake form as well for folks who wish to go that route. And then what we will do is each day reach out to those folks who have identified that they have symptoms and say something like, we are sorry to hear you're not feeling well. Please contact the Student Health Center. Here is their contact information. And then we will connect with Student Health on the back end to make sure that we've taken care of those students. We have a few nuances to work out with faculty and staff. One of which is many of our colleagues are working remote, and there isn't an easy way for me to capture who is doing that. But I made a change to the app today where you can indicate that you are working or learning at a remote location. So that's one component. I want to remind us that the app is an education and self-awareness tool. It's not diagnostic, right? So we're not capturing patient health information. You register only using your slu.edu email address, and that is the only information that is submitted outside of you maybe indicating you have a headache that's out of the norm or you have symptoms. And as we do the contact tracing and work with student health and employee health, we'll start to connect some of the data points to continue to take the same care and concern that we've done as we've navigated this pandemic for the last couple of months. Did I miss anything, Jeff?
That's good. Thank you, Jessica.
Okay.
A question for Dr. Pistello. A question that has come up, it came up in our first town hall and now here again is, and Dr. Lewis talked about it earlier in our this town hall, about who ultimately makes the decision, should we have to pivot and move back online or other major operational decisions, and what factors might go into making that decision?
Yeah, thanks, Mr. Fowler. Before I begin with this, and I'm happy to answer, let me just say clearly to my fellow panelists here, we've all agreed and the message is clear. Everyone on campus has to be wearing a mask all the time when we're in each other's presence. We've got one possible exception due to ADA compliance issues. We will need to investigate that, get an answer soon, and communicate it broadly. So everyone should know that we will do that. So this question keeps coming up, and I'm going to spend a few minutes on it to try to give you some sense of the complexities of it by using a different example. I know that people would look for us to say, okay, if hospitalizations for COVID reach this point, is that it? Is that the magic number? Or if the number of current infections on campus reach this point, or if the overall direction of the region is this positive, is that the point? As Mike said, it's not going to be the flip the switch one way or another as it was in the spring. So I thought it might be helpful. Hopefully it'll be helpful. Let me give you an example in another decision-making process that I think will be similar, less serious, but how it works, some of the complexities and nuances. And I'm going to talk now for just a couple minutes about how I made a decision with respect to closing a university with regard to weather. Always snow inevitably. I had a good friend at Dayton who was a communication instructor, and a couple of times he brought me into his graduate communication class on leadership and decision making, and I talked about this process, and we spent the class talking about it. So it's obviously a different thing, but similar in terms of how this works. So the decision, hours before a decision has to be made, generally it's in the middle of the night, around 4 or 5 a.m. with a known deadline, I would start to collect data. And that data would begin with the vice president for facilities drives into the university, observe what's going on, gets on campus, talks to his facilities people about what the conditions are on campus, and realizes how much time he's got between whatever hour it is and when people will begin to arrive on campus, and makes a determination of how clear the roads were and how clear the campus is or can be. Once he's gathered that information, he places the first call to me, generally 4:35 in the morning. And we start talking. We then consult the highway patrol. What are the reports on the roads? We have the televisions going. What are the newscasters reporting on the roads? We're looking at the weather forecasters. What are the weather forecasters forecasting? What are the current projections? What are the current conditions and future projections? What is the snowfall thus far? How much snowfall is expected moving forward? What's the rate of it falling? What's the wind doing? Because in addition to accumulation, visibility is an important factor. Road conditions. Then there's ice. Is it simply snow or is it ice? We know ice is more serious. What's the temperature now and what will it be? Because we know that our salt can't melt the ice if we get below a certain temperature. So what's the temperature now? What's it going up to? Will the ice have an impact? We look at what other universities are doing because they have different populations. Some are residential, some are mixed, some are all commuter. What are they deciding? Why? What are they seeing? Then we also factor in what point is it in the term? Is this midterm or finals week? That makes a difference. Is it early in the term or late? Can work be made up? Is it a Tuesday, Thursday? That's more difficult to cancel than a Monday, Wednesday, Friday because of the number of sessions. How many times have we canceled thus far? How many Tuesdays or Thursdays or Monday, Wednesday, Fridays have students missed? So how many more are likely? Last October, for example, during finals week, I knew that they were projecting that we were going to have bad weather. And once I left Dayton, no longer provost, I decided at Lemoyne, the provost makes the call there. And here I decided the provost makes the call here because I think it should be the provost. In that case, it's largely an academic matter. And also, I don't like being awakened at 4:30 in the morning. So I knew during finals week that weather was going to be bad. I don't remember which day it was. I think it was early in the week, major storm coming in. I knew that Chet did not have experience with this. And I knew that Chet would be weighing his options. So the first thing I did not long after I woke up is I called my chief of staff, Bob Gagne, and I said, I want to know how many students are taking a final each time slot today. And I think Bob called Jay Hagen. And before I got to campus, I had the answer to that. And then Chet came in my office, as I suspected he would, in the middle of the morning. And Chet said, I'm going to cancel class at noon today because of the storm coming in. And I said, Chet, it's your decision, but I wouldn't do that if I were you, because I've learned that if we cancel at noon, and I had the number, I don't know how many hundreds of students are going to be in a final. If you wait till 2 o'clock, the number of students who are going to miss a final is going to be this much percentage later. So it's, again, gathering all kinds of data, considering all kinds of consequences. The student development perspective, faculty perspective, staff perspective. Students tend to want you to cancel. Staff and many faculty tend to err on that side and realize it's the more cautious thing to do, but you talk to the scientists with labs, they tend to be against it. Talk to student development, particularly when I was at the University of Dayton, which was a party school, they know that those students with a free day off are going to be doing a lot of drinking and sliding down the hill by the main dorm up on the hill, and we often have accidents, so they're pushing not to do that. So sometimes it's neither an either open or close either. It's a delayed opening. And then even once the final decision's made, there's a protocol to go through. Once I made the decision, I had to call the head of PR, who had the codes to call the broadcast stations and newspapers, because sometimes, believe it or not, the broadcast stations get calls saying they're an official university representative and saying we're closing before the decision's made. I can't imagine why anyone would do such a thing. But there are clearly processes that have to be followed. The toughest calls are when there's little or no snow or ice at the moment. It's all done on projections. That's where the risk of a bad call is at a maximum. The more data you've got, the better, if you can actually see and judge what's happening. So there's no set of rules like it's this many inches of snow or it's at this temperature with this many inches of snow. It's within the broader context, trying to weigh all the variables, including the education of our students with the safety of our on and off campus community. So in this, like that, I will get data from as many sources as I can on relevant variables, a range of variables. I will talk with different people. I will get projections from experts. I will ask the opinions of those closest to the issue who know what they are talking about. I will consider the impact of the decision on the various groups of the university. And if there's a clear consensus, it will be an easier decision. If there is not a clear consensus, I have to make the best decision and live with it. And sometimes calls are good and other times they're not. And all of this is just for a snow day, a single day. A call to shut down the institution like we made in March is much more complicated, and so much more is at stake. And it's so much more consequential. So it will be a process. Many people and points will be considered. A lot will be weighed. Many people will be brought into the conversation. And as Mike said, it probably isn't going to look like what happened in March. It's probably going to be more nuanced. So that is the best answer I could give. And I know people would prefer something much cleaner and narrower and quantitative. It's complicated.
I'm going to ask Dr. Ruth Evans, President of the Faculty Senate, has a question, a follow-up question related to if someone's not wearing a mask in class, or what the risk is. Go ahead, Dr. Evans.
Right, thank you, Jeff. Yeah, I was just picking up on the thing about the care that faculty have to take around respecting students with disabilities who are not wearing a mask. And I just want to ask on behalf of faculty, what is faculty autonomy here? What can or cannot faculty do in the classroom? And what's the risk in the classroom to faculty and other students if a student isn't wearing a mask? I mean, if it is a minimal risk, then I think we need a clear message about that, just to reassure faculty that about the situation.
Might ask Terri Rebmann to.
So from a scientific standpoint, distance and masks together are going to be the most protective measures. If you don't have a mask on, but you're still 6 feet apart, it becomes a little blurry, because the risk in terms of how far respiratory droplets can travel is not a black and white issue. So it's not like at 5 feet, 2 inches, you're completely safe, but at 3 feet, you're at really high risk. So that's why it's the combination of masks and distance together that we use to create the most protective environment.
Yeah, no, I understand that very much, but yeah, okay. So a student not wearing a mask is in fact slightly increasing the risk.
Slightly, I mean, much more so if they were, and they wouldn't be, but if they were symptomatic, if they were coughing and sneezing, that would be a much higher risk. If they're in the classroom coughing and sneezing and not having a mask on, that would be a much higher risk than someone who has no symptoms and they're just sitting at a desk and not wearing a mask.
Okay, thank you.
Thank you both. This is a question for Mike Lewis. What do I do if I'm supposed to teach in person and would like to discuss switching to online?
That message went out, I think, last week. We said we asked faculty to contact their chair or their dean if they're in a unit that does not have department chairs. And so, we're still encouraging faculty, if they're able to teach face to face. That's, as I said, last time, over 90% of our students have indicated a desire for face to face education and formation. That is our mission. That's what we do, and so that's what we're aiming to deliver. I understand people's reticence. We've put a lot of effort into the public health precautions. We think that we've put together an incredibly safe campus. If faculty are still concerned, again, I would encourage them to speak with their chair and their dean. I have encouraged the chairs and the deans to be flexible.
Yeah, thank you, Mike. The next question. Guidelines for the city of St. Louis recommend no more than 25 people in social gatherings. How does that affect what we do between classes and other operations? Perhaps I'll ask Dr. Rebmann and Michael Lucido to talk about that.
Sure. So the St. Louis City orders and St. Louis County orders are similar in this regard, that there's a clear differentiation between what you can do for educational purposes, like at a K through 12 school or an institute of higher education, versus what is a social gathering. So they are limiting the size of social gatherings, but in terms of educational situations such as college campuses, if you have distance and mask use and other protective measures, they do allow larger numbers of individuals to be together.
Michael?
I really don't have anything to add, Jeff. Terry's right.
I would just add that I think one key difference between social gatherings and what we're talking about in classrooms is the idea that we have policies that allow you to tell a student they may not come in the door, right? If they're not willing to comply. There are pretty clear levers, including their ability to succeed in a course if they can't be in the room to do the thing that they want to do. And so I think that's pretty different from a social gathering, which is why I appreciate the distinction and the nuance there. It's helpful for me because I think there's a lot more at stake for students in classrooms than there are in social gatherings. And so I appreciate the limits for social gatherings, and I appreciate that a more regimented system with a lot of safeguards in place feels pretty different than a social gathering.
Debbie, if you'll stay, if you'll unmute, the next question's also for you. What is dining going to look like in the grand dining hall? Will students be expected to be physically distanced since their mask will be taken off while eating?
Yes, absolutely they will. I think it's important to know that, and so all of the folks thinking about dining and where students will eat and how they will be spaced have been in close contact with Dr. Rebmann and others to make sure that we're coming at this in a very scientifically appropriate way. It's important to know that all dining establishments on campus will have a real, you may take it with you when you go. You may take it with you. It'll be a very carry-outable kind of experience. So Grand Dining Hall is one of those places where typically students can serve themselves. That's not going to be an option, right? They have to be served. Unfortunately for the environment, a lot of what will happen really has to be in takeout and to-go containers. Students on meal plans that are all you can eat can certainly take as much as they want and can go as often as they want. And so that is not really at risk there. But they have to be spread out. Like, we will not have fountain drinks. They will have cans and bottles, right? There are lots of clear safeguards being put in place, and distance is one of those safeguards. So we're working with Michael Lucido and others to really look at what are the spaces on campus where students can spread out and eat if they can't get into Grand Dining Hall because that space is at capacity. Michael, anything you would add to that?
No, I think just like Grand Dining Hall, we've also socially distanced a lot of the other common spaces in our buildings around campus. And I think we are going to welcome students to utilize those spaces that aren't used or that aren't being used to go to find a place where they can eat their lunch, catch up between classes on some work, or even sit in and attend a Zoom class if they need to.
All right, thank you both. Dr. Costello, we're coming up on the 5:30 hour now. Would you like to have us take more questions, or would you, what are your wishes?
Again, I want to respect people's time as we did last week. Why don't we take one more question, then I'll say a few summary comments. And thanks, Jeff.
Very good. Our final question, what do I do if a colleague or student refuses to or consistently doesn't wear a mask or clearly has symptoms but brushes it off as a cold?
Yeah, so we're just not going to have tolerate people who don't wear masks. What would be the process, and I'll ask you, Mickey, to begin with this, to report a colleague or Debbie, a student, so that we can move as an institution, because it's not tolerable that someone can ignore these protocols?
Sure. So if someone encounters that, they can start, there's really two places to go. One would be to the person to whom that faculty or staff member reports. So notifying that supervisor of the behavior so that it can be addressed through that normal protocol. Another option would be every faculty and staff member across the university has a human resources consultant assigned to their unit. And if they want to reach out to that person, and that you can find who's assigned to your unit by looking on the SLU Human Resources webpage. And then from there, that human resources consultant, we will work to determine what's the best way to handle that situation.
Yeah, Jessica, anything to add there from your perspective? I'm happy to speak about the student side, but I know we've talked about some options there.
Yeah, I just put it into the chat, but I maybe did that privately, so let me make that public, sorry. So Mickey, those are absolutely the right steps. Another option for faculty and staff is to leverage the SLU Integrity Hotline, where you can submit a concern anonymously. I would invite all of us to remember that this situation is so very fluid and complex, that many of us are under different and unique pressures, and that we use enormous grace and respect with each other as we navigate through this time. And I would also invite lots of the questions in the chat, and even this one, and we have answered them in the FAQs on the Return to Campus page on the website. So I would invite all of you to visit that and navigate some of those questions. From a student perspective, Debbie, I think that it would go through the student conduct process, correct? Where it would go through that office?
So it would go through the Department of, and my guess is even if it comes through the hotline to Jessica's team, it'll probably end up in student responsibility and community standards. We have a very thorough set of community standards that SLU students agree to live by. Public health precautions we've added this year would already fall under those, because there is a failure to comply charge that can happen for students violating community standards. So basically it's, you know, other policies as written kind of thing. I know that the student responsibility and community standards team, so they're down a person right now, and they're thinking really creatively about how they're going to handle those concerns, but they're prepared to take them on. They have a very clear plan on how they're going to address those. And like all things in that office, they will really be doing some educating and some deep reflection work with students to understand that your choice might feel like one of autonomy, but you've said yes to the invitation to return, and you've said yes to that invitation knowing what you were committing to. And we have an obligation to others, right? That being for others does not mean out there in the community when you feel like serving. It means putting on your mask and keeping a safe distance. And so I think we're prepared to work with students on those situations. And if you haven't looked at it, so I know we announced a return to campus module that is required for undergraduate students. It was recommended that graduate students, faculty and staff also take a look at that. If you haven't, I would really encourage you to. That was the brainchild of an undergraduate student who gathered a group of peers to really do in a short period of time what none of us on this call would have had the time and resources to do, or even the ingenuity and creativity for. There's some great videos, there's some great content where they're really trying to educate their peers. And I gotta tell you, the number of students I've seen on campus today with masks on gives me a lot of hope. It's often more consistent than my colleagues. So I just, not these colleagues on this call, of course. So I do think they want to be here. They don't want us to have to pivot online. And that to me is the biggest lever we have, right? They actually have a lot of control over whether we can get through the full term. And that's the lesson I think we have to give them as often as we can.
Great, thank you, Debbie. I'll turn it over to Dr. Postello before we conclude, to Dr. Postello for some final comments.
Yeah, I just want to thank all the members of the panel and everyone who participated today. As I said at the opening, it's taken a tremendous amount of effort to get to this point and get ready for the fall term. It's exciting that our students and our new faculty are joining us and ready to go. Thanks everyone for all you put into it. There are going to be bumps. There always are. There'll be more because of the situation under which we are now operating. And as I said, we're all in this together. Thanks, Jeff.
All right, and just one final reminder for everyone. Thank you for, first of all, thank you for all joining us today, being a part of this. This will be, as we said at the outset, will be recorded. It will be posted online. So if you know others who would like to view this, it will be posted online as soon as we can get it online for you. And we appreciate all the questions that have been submitted. They're all very timely and very good. And we appreciate everybody's participation. So on behalf of everybody on the panel, thank you for being with us and have a good evening.